What if I told you that right now, as you're watching this video, you could have a silent time bomb in your blood vessels, an aneurysm, and you wouldn't even know it? In the next 15 minutes, I'll reveal the 3 critical medical tests that doctors use to detect hidden aneurysms before they become life-threatening, plus a simple screening you can discuss with your doctor today. And I'll share something that shocked even me, a basic question your doctor should ask you that could literally save your life, but 70% of patients never get asked. Last month, Helen from Arizona felt perfectly fine when she went for her routine physical. Her doctor decided to run one additional test based on her family history. That simple 10-minute screening revealed a hidden aneurysm that could have ruptured at any moment. Test 1. Ultrasound screening for abdominal aortic aneurysms. The first critical test could detect the most common type of hidden aneurysm in just 10 minutes, and it's completely painless. Abdominal aortic aneurysms affect your body's largest blood vessel, the aorta, which runs through your abdomen and supplies blood to your lower body. According to the Centers for Disease Control and Prevention, these aneurysms cause over 10,000 deaths annually in the United States, yet most people have never heard of them. The CDC specifically recommends screening for men aged 65 to 75 who have ever smoked, but many doctors now suggest broader screening guidelines. Research from Johns Hopkins shows that early detection through ultrasound screening reduces death rates by up to 43% because it catches these aneurysms before they reach dangerous sizes. The screening itself is remarkably simple and takes place right in your doctor's office or a nearby medical facility. A technician applies gel to your abdomen and moves an ultrasound wand over your belly, just like the ultrasounds pregnant women receive. You lie comfortably on an examination table while the technician captures images of your aorta on a computer screen. The entire process takes between 10 and 15 minutes, causes no discomfort, and requires no preparation on your part. You can eat normally before the test, take your regular medications, and drive yourself home afterward. The ultrasound waves create detailed pictures that show the size and condition of your aorta, revealing any bulging or weakness that could indicate an aneurysm. Most abdominal aortic aneurysms grow slowly and silently over years, causing no symptoms until they reach a critical size or rupture. When rupture occurs, it creates a medical emergency with survival rates below 50%, even with immediate surgery. The frightening reality is that most people feel completely normal right up until the moment of rupture. Harold from Texas told me he was mowing his lawn on a Saturday afternoon when sudden, severe back pain dropped him to his knees. His aneurysm had begun leaking. Emergency surgery saved his life, but he wished he had known about screening years earlier. If Harold had received an ultrasound screening, doctors could have monitored his aneurysm and planned treatment long before it became life-threatening. Ask your doctor today whether you should receive abdominal aortic aneurysm screening, especially if you're over 65, have a history of smoking, or have family members who've had aneurysms. Medicare and most insurance plans cover this screening when medically appropriate, so cost shouldn't prevent you from getting this potentially life-saving test. Don't wait for symptoms that may never come. Take action now while early detection can make all the difference. Test 2. CT angiography for brain aneurysms. What if a severe headache isn't just stress, but your brain warning you of hidden danger lurking in your blood vessels? Brain aneurysms affect approximately 6 million Americans, and while many remain stable throughout a person's lifetime, others can rupture without warning, causing devastating strokes or death. According to Mayo Clinic neurologists, CT angiography has revolutionized our ability to detect brain aneurysms before they cause problems. This advanced imaging technology combines the power of CT scanning with special contrast dye to create detailed three-dimensional pictures of blood vessels in your brain. Research from Harvard Medical School shows that CT angiography can detect aneurysms as small as 2 millimeters, giving doctors the information they need to monitor or treat these potentially dangerous bulges. The CT angiography procedure takes place in a hospital radiology department and typically lasts 30 to 60 minutes from start to finish. Before the scan, a technician inserts a small IV line into your arm to deliver contrast dye that makes your blood vessels visible on the images. You lie on a motorized table that slides into the CT scanner, which looks like a large donut. During the actual scanning, which takes only a few minutes, you must remain very still while the machine rotates around your head, taking hundreds of detailed pictures. The contrast dye may cause a warm sensation throughout your body or a metallic taste in your mouth, but these effects are temporary and harmless. Most people find the experience much less intimidating than they expected, and the detailed information it provides can be truly life-saving. Brain aneurysms often develop at weak points where blood vessels branch or curve, creating small balloon-like bulges that gradually expand over time. While many brain aneurysms never cause problems, rupture can occur suddenly and without warning, leading to a type of stroke called subarachnoid hemorrhage. Vivian from Michigan experienced what she described as the worst headache of her life while gardening on a Sunday morning. Her daughter immediately drove her to the emergency room, where CT angiography revealed a ruptured brain aneurysm. Emergency surgery saved Vivian's life, but she faced months of rehabilitation and permanent changes to her daily abilities. Early detection through screening could have identified Vivian's aneurysm years before rupture, allowing doctors to monitor it closely or recommend preventive treatment when the timing was optimal. Discuss CT angiography screening with your doctor if you have a family history of brain aneurysms, have experienced unusually severe headaches, or have other risk factors such as high blood pressure or a history of head injuries. While not everyone needs brain aneurysm screening, those with specific risk factors benefit enormously from early detection and monitoring. Your brain deserves this level of protection. Schedule that conversation with your doctor today and don't delay taking action when prevention is still possible. Test 3. MRI screening for thoracic aneurysms. The third critical test reveals aneurysms hiding in your chest that regular checkups and routine tests completely miss. Thoracic aneurysms develop in the section of your aorta that runs through your chest, near your heart and lungs, making them particularly dangerous because rupture can immediately affect your heart's ability to pump blood effectively. According to the American Heart Association, thoracic aneurysms often remain undetected until they reach dangerous sizes because they rarely cause early symptoms. Magnetic resonance imaging, or MRI, provides the most detailed pictures of thoracic aneurysms without using radiation or invasive procedures. Cardiologists at Johns Hopkins report that MRI screening can detect thoracic aneurysms in their earliest stages, when monitoring and preventive treatment options are most effective and safest for patients. MRI screening for thoracic aneurysms takes place in a specialized imaging center and requires about 45 minutes to complete. The MRI machine uses powerful magnetic fields and radio waves to create incredibly detailed pictures of your chest structures, including your heart, major blood vessels, and surrounding tissues. You lie on a padded table that slides into the MRI scanner, which resembles a large tunnel. During the scan, you'll hear rhythmic knocking and tapping sounds as the machine takes pictures from multiple angles. Many facilities provide headphones with music to make the experience more comfortable, and you can communicate with the technologist through an intercom system at any time. Unlike CT scans, MRI requires no radiation exposure and typically needs no contrast dye, making it particularly safe for repeated screening over time. Thoracic aneurysms can affect different sections of the aorta in your chest, and their location determines the specific risks and symptoms they might eventually cause. Aneurysms near the root of your aorta can affect your heart valves, while those in the ascending or descending portions can compress nearby structures like your windpipe or swallowing tube. Eugene from Florida developed a persistent cough that his family doctor initially attributed to seasonal allergies. When the cough persisted for months and began affecting his sleep, further testing revealed a thoracic aneurysm that was pressing against his windpipe. MRI screening showed the exact size and location of Eugene's aneurysm, allowing his cardiac surgeon to plan the optimal timing and approach for repair. Early detection gave Eugene options that wouldn't have been available if the aneurysm had been discovered during an emergency situation. Request thoracic MRI screening if you have a family history of aortic aneurysms, connective tissue disorders, or have experienced unexplained chest discomfort or persistent cough. Many insurance plans cover thoracic aneurysm screening when specific risk factors are present, and the peace of mind that comes from knowing your aorta is healthy is invaluable. Early detection here means early protection, so don't delay having this important conversation with your healthcare provider. Warning signs. You should never ignore your body often sends clear signals before aneurysms become immediately life-threatening, and recognizing these warning signs could save your life or the life of someone you love. According to emergency medicine physicians at Harvard Medical School, certain symptoms should trigger immediate medical evaluation because they may indicate an aneurysm that's expanding rapidly or beginning to leak. Sudden severe pain that feels different from anything you've experienced before tops the list of warning signs that demand immediate attention. This pain often occurs in the back, abdomen, or chest, depending on the aneurysm's location, and patients frequently describe it as tearing or ripping sensation. The American College of Emergency Physicians emphasizes that aneurysm-related pain typically reaches maximum intensity within seconds or minutes, unlike other types of pain that gradually worsen over time. Additional warning signs include sudden, severe headaches that feel completely different from your usual headaches, unexplained fainting episodes, rapid heart rate accompanied by sweating and nausea, or sudden difficulty swallowing or breathing. Changes in your voice, persistent cough without cold symptoms, or unexplained back pain that doesn't improve with rest can also signal thoracic aneurysms pressing on nearby structures. Abdominal aneurysms may cause a pulsing sensation in your belly that you can feel with your hand, especially when lying down quietly. These symptoms don't always mean you have an aneurysm, but they require immediate medical evaluation to rule out this potentially life-threatening condition. Emergency room physicians see patients every day who ignored these warning signs for hours or days, sometimes with tragic consequences. Frank from Nevada woke up with severe back pain that he initially blamed on sleeping wrong or overdoing yard work the previous day. When the pain intensified and spread to his abdomen, his wife insisted they go to the emergency room despite Frank's protests that it was probably just a pulled muscle. CT scanning revealed a large abdominal aortic aneurysm that was beginning to leak, requiring immediate surgery. Frank's surgeon told him that waiting even a few more hours could have been fatal. The warning signs Frank experienced were his body's way of alerting him to immediate danger, and acting quickly on those signs saved his life. Never ignore sudden severe pain, especially if it feels different from anything you've experienced before, and seek immediate medical attention if you develop any combination of the warning signs I've described. Emergency rooms are equipped to quickly evaluate aneurysm-related symptoms and can perform life-saving imaging tests within minutes of your arrival. These signs demand immediate action because every minute counts when an aneurysm is becoming unstable. The simple home assessment discussion. Here's the conversation starter that could save your life at your next doctor visit. And it's simpler than you might imagine. Most people don't realize that a few basic questions about your family history and personal risk factors can help your doctor determine whether aneurysm screening is appropriate for you. According to preventive care guidelines from the American College of Cardiology and the American Heart Association, patients who ask informed questions about aneurysm screening often receive more comprehensive evaluations than those who rely solely on routine checkups. The conversation begins with a simple question. Doctor, based on my age and health history, should I be screened for aneurysms? This single question opens the door to a discussion that could identify hidden risks and potentially save your life. Prepare for this conversation by gathering information about your family's medical history, particularly any relatives who experienced sudden deaths, strokes, or required emergency vascular surgery. Write down any symptoms you've experienced that might be related to aneurysms, including unusual headaches, chest discomfort, back pain, or changes in your voice or swallowing. Mention if you've ever smoked, have high blood pressure, or have been diagnosed with connective tissue disorders. Your doctor needs this information to assess your individual risk level and recommend appropriate screening tests. Many patients assume their doctors automatically know when screening is needed, but proactive communication from you ensures nothing important gets overlooked during busy office visits. Bring a list of specific questions to your appointment, such as which type of aneurysm screening would be most appropriate for your situation, how often screening should be repeated, and what symptoms should prompt immediate medical attention. Ask about your insurance coverage for aneurysm screening and whether your doctor recommends any lifestyle changes to reduce your risk. Dorothy from Oregon told me that asking these questions during her annual physical led to abdominal aortic aneurysm screening that detected a small aneurysm her doctor now monitors every 6 months. Dorothy's proactive approach to her healthcare gave her and her family peace of mind and a clear plan for managing her condition before it becomes dangerous. Schedule an appointment with your primary care doctor within the next 2 weeks, specifically to discuss aneurysm screening and risk assessment. Don't wait for your next routine physical or assume this conversation can happen during a visit for other health concerns. Prepare your questions in advance and bring written notes about your family history and symptoms. Your future self will thank you for taking this crucial step toward comprehensive health care and early detection of potentially life-threatening conditions. You now have the knowledge to take control of your vascular health through 3 critical screening tests and the warning signs that could protect you from hidden aneurysms. Early detection isn't just possible. It's your right and your responsibility to pursue comprehensive healthcare that addresses these silent threats. The conversation with your doctor starts with your questions, and the screening tests I've described can provide answers that literally save lives. If this information opened your eyes to the importance of aneurysm screening, give this video a thumbs up and share it with other seniors who deserve this knowledge. Tell me in the comments, have you ever discussed aneurysm screening with your doctor, and what questions will you ask at your next appointment? Your experience could help someone else take that crucial first step toward protection and peace of mind.